Hi, we're Admiral Brian Fort here, joined today by Captain Drew Bigby, SEAL of the Naval Hospital. Together, the two of us are going to talk to you about the coronavirus and continue the conversation we started 2 weeks ago. First, I want to start with where we left off. The best way to prevent the spread of this virus is to practice good individual and community health. By individual health, wash your hands frequently, use hand sanitizer, practice good coughing and sneezing techniques into your arm. Make sure you don't touch your face. For collective health, minimize travel unless it's absolutely necessary. And part of that means minimizing attendance at large gatherings. Those things together will help minimize the spread of this virus and keep all of our families and our service members and dependents safe and healthy. Now, the most important thing out of all of that is if you feel sick, don't come into work. Call in, let your supervisor know, and if you would normally go see a provider, your hospital provider, then go do that. Make an appointment and get to your hospital and get checked out by your doctor. Okay, so now I'm going to turn it over to Captain Drew Bigby, who's going to talk about what you should expect if you arrive at the hospital for an appointment, and certainly if you are tested for COVID-19. Drew?
Thanks, Admiral. Today I want to talk to you about if you or your family member have flu-like symptoms. When I mean flu-like symptoms, do you have a fever, respiratory distress, or having problems breathing? If that is the case, both the hospital and the branch clinics have posted phone numbers for you to contact. They will give you reporting instructions. Please follow those, not only to protect yourself, other patients, but also the medical staff. Once you arrive, you'll be seen by a provider where you'll take a long history, a physical exam, and maybe viral testing for strep, for flu, and if medically indicated, COVID-19. COVID-19 testing is 2 swabs, one for your mouth and one for your nose. Those swabs can be processed through the Japanese public health system or back in the United States. That testing is usually 3 to 7 days. Anyone that is tested for COVID-19 will be put in isolation. I'd like to talk about what that means. Isolation means you are away from your family member or others, and your pets and children. You need a private bathroom and a private bedroom. You'll be contacted daily by my staff to make sure you are well, and if you're not, you'll be asked to be brought in. Those who've been in contact with you will also be put in another category called quarantine. That means someone who's been in contact with a potential COVID-19 patient but is not symptomatic, means you're not sick yet. Once those results come back, you'll be contacted and you'll be dispositioned accordingly.
Each individual, each family, and each situation are unique. What I want you to know is that from the region and the installation teams and everyone in our medical community, we are here and ready to help. Your health is our primary concern. In addition to individual and collective health, we also have a responsibility not to spread any potential contagion. We've already talked about minimizing travel. We've talked about minimizing attendance at large gatherings. Each of our installations has also taken precautionary measures, and we're looking at further preventative measures. The best way you can stay informed is keep up with our social media pages and also see the information that the region team is putting out every Tuesday and every Friday with a fact sheet. Please stay up to date, and then you and your family can be informed.
You've seen on many social media sites from the region to the hospital the importance of hand hygiene, what good hand hygiene is and what is not. Most important thing I can tell you today is wash your hands often with at least 20 seconds of soap and water or use hand sanitizer. Avoid long contact with someone who's ill. And most important, like the Admiral said earlier, if you're ill, don't go to work. Know your supervisor contact information, or at least call the quarterback and let them know you are ill and not coming to work.
Okay, thank you for everyone's continued support of all the initiatives, the precautionary measures that we put in place. Please stay tuned to our Facebook sites. Our priorities remain the same. Your individual and collective health, making sure that we minimize the spread of this, and making sure that our force is ready for anything that we're called to do. Thank you for your time.